Hope Cross.
Hey, how are you today, this beautiful Friday?
What is going on? We are here for episode 2. We are back. There were rumors that this thing would be done after episode 1, and we have already dispelled those rumors, Hope.
I try not to listen to rumors, Curtis.
Oh, yeah. I like it. I think Dr. Dre said, I hear them, but I don't pay attention to them. So I think that's going to be the theme of today. How are you feeling today?
Feeling good. Feeling good. I have my coffee and ready to go.
Ready to go. And I know you just got done with training.
Yeah.
Well, what they have you doing on a Friday, Hope?
So I've been working with healthy families for the past 11 months. So we've done a year culture contract to train trauma-informed care and resiliency. So every month we get together, we work on a new workshop, and they actually just signed up for a whole nother year of culture training. So I'm excited. That'll kick off in July.
Let's go, Hope. And what type of culture are you creating for those cats in the background? Because they seem very animated today.
Well, she's sleeping, so it's a sleepy culture.
Oh, all right. So what was I hearing? Maybe that's our guest. Maybe our guest has cats in the background as too. We're going to bring our guest on here shortly, Hope. But speaking of that, let's talk about what we got planned for today. Last Friday, you were a rock star. You were my hero because you had a conversation with me for up 3 hours. And I know that's not easy, Hope. There's this rumor that I like to hear my voice for hours at a time. And last week, I contributed to that rumor being true. So you saved me, Hope.
Yeah, that rumor is true, but it's okay. It's okay.
I appreciate that, Hope. Well, today we're going to work to get past that rumor because we have a full episode here. We have 3 different guests. So on our agenda today, we're going to be talking about St. Augustine Youth Services. We have Dennis and Tim, who's going to break down some of the important work that they're doing over there. We also have Malyn Smith, who is a workforce development expert and specifically related to Job Corps. She's going to talk about maybe some success stories with Job Corps, some things going on that side, her opinion on what's been happening recently. And then we are going to highlight a small startup program in Florida called Kingdom Catch, which helps young people, specifically foster youth, by taking them out fishing and doing some really cool stuff. I'll let Jimmy talk about that. So speaking of that, let's welcome our guest to the stage. I have here Mr. Tim Decker. How you doing, Tim?
Fantastic. How's it going?
Hey, Tim.
Doing good. And then I have Dennis. How you doing, Dennis?
Hey, great. Happy Friday. Doing well. How about you guys?
Hey, great. Nice to meet you guys.
And I heard the cat as well, and it's not here. I don't know where the cat's at.
It's not in my office either.
Oh, maybe I'm just used to it and I don't hear it anymore.
Oh, somebody has a cat. And they're just not willing to own up on it. So, we'll figure this out. That'll be
mine, and she's asleep. So, I don't know. Maybe it's a baby.
You know what? Let's make that a poll question for the audience. If you're watching, go in the comments. And out of these 4 individuals you're listening to, which one is most likely to be hiding a cat in the background of their screen? Let's see what the audience feels, what their thoughts are, and we'll get it started. So, Tim and Dennis, St. Augustine Youth Services. Hope, I came across St. Augustine on LinkedIn. I like any program in Florida that serves youth and families. I kind of like to keep an eye on them, see the success stories they're doing, see what impacts they're having in the state of Florida. And St. Augustine Youth Services, and can I just say SAYS? Is that the appropriate acronym? Yes. SAYS does so many things. And I was going down this rabbit hole and I was like, I'm not sure if there's a certain population that they're not in some way helping, with one of their areas being a mobile response team, where we're going to focus our discussion today, which just sounds like I'm really big hoping, we talked about this, is if something's working, then my first question is, why in the world are we not doing this more? Right. That's the very, what is happening here? And that's big when I travel to different places across the country. You see something happening in Kentucky that's working. Why is this not happening in Florida or vice versa? So I had a chance to connect with the SAYS team, and what they do with the mobile response team needs to be happening everywhere. So I want to unpack that, let the audience know, and have a good conversation with that. But let's start here. Tim, can you give us an overview, a little bit, the elevator pitch, and then we'll pass it to Dennis as well. What does SAYS do? Who do you serve? Tell us a little bit about you.
So our world is youth mental health. We serve kids anywhere from 6 years old up to young adults at age 25 through that mobile response team. A couple of our other programs cap out at age 18 with your traditional foster care youth, and then age 21 and one of the other or two of the others. And we've been around for 35 years now.
Wow.
We've got youth residential group homes. So we've got high quality therapeutic group homes. We're QRTP certified. And then we've got a pre-independent living group home, and we're working on an independent living village that we hope to have opened up by December of 2026. So, we kind of work through the whole spectrum of youth, and youth mental health is our thing, though. We really try not to branch outside of that.
Wow.
That's incredible. Wow. So see what I was saying, Hope?
Yeah.
It's that line.
35 years?
In 1989, we started up. And we had two little small group homes down in downtown old St. Augustine, a couple of houses built in like the 1930s. And we moved here to this beautiful campus we have now in 2015.
That is phenomenal. And I can't believe it's been around that long and we're just now hearing about it. So I'm excited to hear more.
Yeah. That drives me crazy. We were talking about that last episode. It's like, this thing is 20 minutes away. This thing's 2 hours away. And we just are now hearing about it. Dennis, tell us a little bit about what you do. Let us know the good work you're doing over there.
Yeah, so I'm the Chief Operating Officer here at St. Augustine Youth Services. Been fortunate to be part of this agency since 2000. Like Tim described, we do have residential treatment, and then starting in 2015, we started to branch out and diversify what we do. We brought on the mobile response team that you had talked about back in 2015, and then 2017 and 2018, we expanded with two more team-based kind of models that provide in-home outpatient intensive services to the community. So those are the programs that we're offering now. And so we are happy to be able to offer that to St. Johns County as far as those services. And I did want to point out too, one of our team-based model programs, Coaches, and the Coaches program also serves Flagler and Putnam County.
Awesome. So part of the Aware News Network and why we are having this live stream is the very first thing we want to do is raise awareness and educate members of our community, the individuals that are out there helping others, and then the services that are available for them to help our neighbors, our friends, anybody in the helping profession. So where I want to start with the mobile response team is, what is the reason it was created? I know it started in 2015. And then the other part of Aware is all about being solution focused and helping to identify some areas where we can continue to grow and help others in a better way. So my first question is, what was the reason it was created, and what problem are we attempting to solve? Who are we attempting to help with the mobile response team?
Yeah, there was a rise, a trend and a rise in behavioral health, mental health crises, in the community. And, with that, there was an increase in the amount of involuntary psychiatric placements for people that needed assistance. So the mobile response team was created to be able to more readily provide on-site crisis intervention and also provide services to prevent those type of crises from happening again. And so the mobile response team not only provides crisis intervention, but it also provides care coordination after the crisis event to be able to put services and resources in place for clients and families to help them kind of work through those issues. And as you guys can recall, back in, I believe it was 2018 with the Parkland shooting, that was another catalyst for the importance of mental health awareness and mental health services. And so around that time, there was more increased funding to be able to have these mobile response teams an increase in the mobile response teams, and then also just coverage with these mobile response teams throughout the state of Florida.
I love that. So talk to me a little bit about the team. Who is on the mobile response team when they get called out?
Yeah, so the team is led by a licensed clinician, and they're licensed in the state of Florida, either as a marriage and family therapist, licensed mental health clinician, or licensed clinical social worker. And that supervisor will also respond to calls, but has a team of licensed clinicians and master's level clinicians that when a call comes through the hotline, they're able to respond. And it is a requirement that we respond within 60 minutes. So the proximity is there for us to be able to do that. And then beyond the licensed clinicians and the master's level folks that respond to the calls, we have case managers that will do follow-up calls with anyone that has a hotline call. And that's where we're able to identify what other kind of needs they have post-crisis situation to be able to help put them in a better place following that. Also have what's called a peer support specialist, and they help kind of provide an extra layer of engagement and support with any of the clients and families that might need that, or that might need some encouragement, or like I said, additional kind of guidance to understanding what the needs and processes are to help engage them in treatment and services.
I love that. So Hope, last week we placed a lot of emphasis on the high fidelity wraparound approach. And correct me if I'm wrong, Dennis, it's in that same vein as someone with lived experience, so that they can, it's almost like you're ingraining empathy into that interaction from having someone who's been through something similar.
Oh, absolutely. Yeah. And the way you just described it. And, we're fortunate we have that that staff member, not only in mobile response, but in our other programs as well. So we really, really see the value in doing that. But like you said, it is an ingrained way to be able to establish and build rapport.
I love that. So Tim, talk to me a little bit about the numbers. Now, obviously we have success stories. We believe it works, but sometimes that data helps put more emphasis on that point. So talk to me about how you're improving it from a fiscal standpoint, potentially saving money, and then also maybe reducing some potential trauma that's happening, as opposed to just sending these young people to these Baker Acts. We're able to reduce the trauma that's associated with that experience.
Yeah, since the inception of this program, SAYS has successfully diverted 87% of the kids away from Baker Act. So of all the calls we've done since 2015, 87% of those kids have not been Baker Acted. And prior to these programs, almost all of them would have been Baker Acted. So, if you look at that, I don't have the number here in front of me, but I calculated it at one point. It was like 9,000 hours of trauma that kids had avoided by not being in a Baker Act facility. So that's just huge. And that's probably where we need to look first. If we think about the kids first, we're always off on a good foot. But if you look at that just from the taxpayer perspective, those Baker Acts are generally going to be Medicaid funded, probably 9 times out of 10. Here in our area, at least, they're $3,900 a pop. So for that 72 hours, assuming you don't stay even longer, that's almost a $4,000 charge that we, the taxpayers, would have been paying for that service. And when you look at it that way, just last year, the mobile response team did 400 youth. A few of those may have been repeat calls. But let's just say 400 youth times that 87%. You take that number of youth times $3,900, and it comes out to around the neighborhood of like $1.4 million in terms of your return on investment. And again, that's just that one problem. That doesn't take into account our community action team, C.A.P.E for short, and the coaches team that Dennis mentioned. So we're saving the community millions of dollars by serving these kids out in the community in the least intrusive way possible, and at a way that's less expensive than the DJJ programs, the traditional foster care, therapeutic foster care, or a Baker Act, all of which have a higher cost per day than the programs that we're offering in the community. But again, it really all to me goes back to how much trauma can we save these kids when they don't have to get in a police car with, handcuffs on, because the police will put them in handcuffs every time. They were required to do that, at least until here just recently. I think they have some discretion, but they're still usually going to go in handcuffs. And the back of a police car with a radio blaring and a person in a uniform with a gun and a taser on their side. So being able to save the kids, all of that is huge in my book. And for the people that are more fiscally concerned, then we're also saving the community a lot of money.
I love that. Would it be fair that's part of the reason you guys began in 2015 in the first place, is these crises would occur and teams would go out there that either weren't prepared to handle it or they just handled it with whatever resources they had on site, potentially leading to these things escalating and causing trauma. And like you said, even more cost to the taxpayer on the back end as well.
Yeah, most of it was law enforcement handling the calls then. I don't think there were a lot of crisis response teams even in place until, the state decided. And it wasn't just in our area, it was across the entire states. Baker acted for kids anywhere as young as 5 years old, or Baker Acts for kids as young as 5 years old were just exploding. And it was a discussion throughout the state and in the legislature and everywhere else, and with law enforcement. So, people started putting their heads together to try to come up with something to work. And every area in Florida now has a mobile response team, but they don't all operate the same. They aren't all 24/7. We didn't start out 24/7, but we are now. We even had a staff go out during the hurricane evacuation last year. Our staff stays in the shelter. And so, everybody has it, but that's definitely why it started, was just the explosion in Baker Acts and how traumatic those are for our kids.
Hey, Curtis, I wanted to add to that too, like with the law enforcement, like Tim was saying, that was one of the things when we first developed this program. We had to really work closely with the school district for one, and then law enforcement. They have a crisis intervention training that they do, and there's a youth mental health component to that. So they would come on our campus and learn about mental health and that sort of thing. But the consensus was, the St. Johns County Sheriff's Office, they're the experts in enforcing the law, and they looked at the mobile response team clinicians as the experts in mental health. So they would default to the experts in mental health during that kind of crisis situation. And so we worked really well, collaboratively when we would respond to calls, and they would default to the crisis team to be able to handle those situations.
And now they actually have a co-responding team of mental health trained officers who are therapists as well. And so we'll co-respond to a lot of calls. And so if it gets really unsafe, they're there to handle that. That's not what our staff are trained for any kind of physical altercations. But if there's any way that they can allow us to resolve that situation without Baker acting a child or putting them in a police car, they're all in. We have a fantastic relationship with the sheriff's office.
I love that. And did I hear correctly that you're 24/7, 365 days?
That's correct.
Wow. The dedication your team has to have because essentially they're on call for crises. So this isn't I'm on call to go to work to, I don't want to minimize anything people do,
yeah.
But you know what I mean? Like, so you have to really find people who understand the why behind their work and helping others. So let's talk about, you said this is all across the state of Florida, but it appears, at least the awareness from county to county can vary depending on what exactly the mobile response team can and should do. So I just want to clarify a couple areas. If there's a crisis at a school versus a parent is having at a home versus if there's at a rec center, what are the differences, if any, on how your team would get involved with those different areas of where the crisis takes place?
Well, the calls will come in a couple of different ways. That there is a hotline number that we have, and when someone calls the hotline number, it will ask them to choose. If they're 25 and under, the call gets routed to St. Augustine Youth Services. If they're 26 and over, it gets routed to Epic Behavioral Health for St. Johns County. It also gets, we get access through 911 and 988. When they get calls to 911 or 988, the dispatch for 911 kind of determines whether or not they can actually call MRT as well. So they would get MRT involved if it is a behavioral health crisis. And then 988, as you guys likely know, that's a crisis hotline as well. So when calls come through there, they're able to route the calls, the appropriate calls to the mobile response team. But in any of those situations you presented, our team could get called. It would just be a matter of sometimes whether it was a law enforcement issue or not, and if it was an issue that escalated to the point of requiring intervention for a behavioral health crisis.
Gotcha.
Yeah.
So these calls don't come directly to you; they go to a hub that then determines the best appropriate place for the call to go.
Yeah, the hotline. If it calls the hotline, then the call will get routed to us, and then, like I said, 988 will connect the caller to us, and then 911 dispatch will contact the mobile response team if needed.
Gotcha. Is there a central website that people can go to find out what their hotline is in each county? Does it vary from each county?
Yeah, the number varies from each county, and there is through the Department of Children, the My Florida Families Department of Children website. There is a section there for mobile response teams in Florida. You'll see it lists 50 plus teams there, and it does have by county the phone number that you can call to get access to the team. And our hotline number is on there as well.
Gotcha. And then you said for the individuals that are receiving these services, there is no cost to them.
There's no cost, correct.
The whole goal is to provide those immediate supports and then reduce the Baker Act, as long as some situations I imagine might have to happen, but ideally we want to reduce the likelihood that does occur. And then after that, there is some sort of supports put in place or some person that's helping them prevent reoccurrences of what occurred?
That's correct. Yeah, we will have one of our case managers will contact every person that makes a call to the hotline to do a follow-up to see if there are any other services needed or any other type of services that we can provide. Our team can also provide stopgap type therapy services if needed, for example. And then if we find that there's a client or a caller that needs some kind of therapy or that needs some kind of case management or psychiatric medication management, that sort of thing, then we can help with that as well.
And that's huge. I mean, I did some research recently on the number of the population to provider ratio, and it was around 740 to 1. In our county, in Putnam County and Flagler County are all similarly situated, and there's just a huge gap. So it can be anywhere from 60 to 90 days if someone's trying to get themselves connected to services out there in the community. And if you're in crisis today, and then tomorrow I tell you it's going to be 60 days before I can get you into an outpatient therapist, that's a big problem for families. So, Dennis's teams, our teams here, it says being able to cover that gap while we're getting people connected to their, either insurance or Medicaid services out there in the community is just a lifesaver for a lot of these families.
Wow.
And just a frame of reference for you guys, our numbers in terms of the volume of calls last fiscal year, 23-24 was 399 calls. The year prior to that was 480. Just to give you an idea of the volume of calls that we receive.
And if we can, either Tim or Dennis, put in the comments there some information that our viewers can reference either directly to your program or some of that hub for the crisis information. And if for our viewers, if you have questions for the mobile response team or about the work that they do, put that in the comments for us as well. What about potential misconceptions of what a mobile response team is or what happens if they get contacted? What are some potential misconceptions or myths around this area that we might want to dispel now for our viewers?
Yeah, I think, go ahead, Tim.
Now, the one thing that I, have faced throughout my career, and I've worked in now where I'm at in fundraising, but I've worked in a lot of direct care and case management of the dependency system is it's going to be one of those things where you come pick up my kid and fix them and bring them back.
Yeah.
And that's not really how it works. We work with the community or with the family in a holistic nature. So we're going to work with mom and dad and how they're relating to the youth. We're going to work with the kids and how they're relating to mom and dad. We might, maybe a situational thing where the parents are out of work and struggling to make ends meet. So they're coming home and taking that stress out on the kids. And so, we try to help families find work, get training, get their license, whatever it may be. But we're looking at the family kind of like you talked about wraparound, and we practice the high fidelity wraparound model here. So it's nothing about me without me. So we work with the whole family to try to get everybody in a better place so that they're stable once we're gone. And I could talk about some misconceptions on the financial end as well, but Dennis may have more to add, here specifically.
What I was it was actually just kind of around the same thing you were talking about. One of the big misconceptions is, people calling for issues that aren't necessarily behavioral health or mental health crises. It could be things going on in the home that day that they're getting frustrated with someone in the home, they're getting frustrated with their child or something like that. And, being able to call for a reason other than a behavioral health to have someone come out and assist. So it's, so we're not built for that. We are built for, like I said, the mental health, behavioral health crisis situation.
Gotcha. And I can't believe how fast time is going. So we need to definitely have you both on this live stream again. But before we wrap up, can talk to us a little bit about your funding stream. How do you pay your team? Where do you get your funding? How does this thing exist? Where is it coming from?
So primarily it does come from funding from the state, from the Department of Children and Families. And they make that available statewide, and in each region there is a what's called a managing entity that handles all of that money, and from there they're able to identify providers to be able to provide the service. So in our region it's Lutheran Services, LSF Health Systems, and so primarily our funding comes from there. As the development director, Tim also supplements funding in areas where we need it. And so he can speak on a couple of those, but we do get some funding from the county and the United Way as well.
Yeah, as a general rule, our programs are all underfunded. When we talk about those institutional funders, LSF, DCF, whatnot, for instance, a couple of years ago, they asked us to expand a couple of our teams, and we did. So we added additional case managers, therapists, peer supports, and then that money wasn't recurring the next year. So, this year, for example, we started out probably $250,000 or more, depending on the program, underfunded for each of our 3 community programs. And we can't cross borders with the money. So we can't use MRT money to support coaches if MRT happens to be flush. And so the rest of that money comes really from private donors, foundations, whoever we in the fundraising department can find to support our work. And that's the struggle with that, is a lot of times people assume because we receive state funds that we're just fully flush with money and we don't have to worry about it, and people don't need our support. But we can't survive without public support, to the tune of probably close to $1 million a year, that when we have shortages in MRT or coaches or CAT, we don't have to lay those staff off. We can fill those blanks with the fundraising money.
Yeah, and I think this is a good example of one of those services that when people don't necessarily hear about it a lot, that means it's working, right? Because, when you're reducing the escalation of crisis, you're reducing a trauma, your things aren't reoccurring because those systems are being put in place, or services put in place that you're giving. You're probably not going. It's not going to be as loud. You're not going to hear about it as much. But that doesn't mean that it's not needed and it shouldn't be talked about. And when you talk about sending professionals that truly care about the nuance of a crisis, as opposed to just responding to that surface level behavior and potentially escalating it, I can't see any reason why something like this shouldn't exist, and why it shouldn't be continued to exist and be continued to be funded and supported. So with that being said, how can people support you? How can people get involved? Tell us a little bit about, for our viewers, if they want to learn more.
Yeah, I know we're running short on time, so I'll just say go to our website. I put that there in the chat, www.sezkids.org. We've got an events tab there. You can see the events we have. We have a few significant fundraisers throughout the year. Our Santa Run 5K, our trade winds auction, and tonight and tomorrow, we've got our 26th annual Wildwood Fishing Tournament. All that money for each of those events goes directly toward helping our kids and filling some of those blanks that we're talking about in terms of cash flow for the program. So, and then of course there's volunteer opportunities here on campus as well. So we appreciate any way that anybody wants to get involved.
I love that. So they could donate their time, they could donate their money, they can share your success stories to potentially reach with people who can donate in those ways. And then I'm assuming too, they could find you on social media, on some of these social media accounts.
LinkedIn, Facebook, and Instagram. It's at St. Augustine STA St. Augustine Youth Services.
Awesome. Yeah, come on, people. We don't just have to follow TikTok dances and what's going on in the media world. We can follow some of the programs that are making a difference, and there's no doubt that you all are. We are going to need you back after this, so hopefully we can continue this conversation. I speak on behalf of myself, and I'm sure Hope. We really appreciate the work that you do, and this is kind of planting some seeds for me that I need to reach out locally and find out, hey, what's going on? We need to get some of some hometown people on here as well, so we can
Absolutely.
make sure that they're aware. Final thoughts and comments from the group.
No, I just wanted to, it was our pleasure to be here. Thanks for, allowing us to join. The other thing that a lot of our programs do, including MR2, is outreach activities. So, it is something that we want to make sure the community knows is out there and available. And so, if we have other opportunities in the future to do this kind of thing and to be able to provide this information, you can count us in.
I appreciate that.
And I want to let you guys know, if you send us information about future fundraisers or events, let us know, because both of us work throughout the state and actually throughout the United States, and we can share it, we can promote it. We can come alongside you in a lot of those ways. Especially, I love fund development, so that's something that I think is really important when it comes to providing these services for the clients.
Awesome. Thank you.
Yeah, same here. If we could help by amplifying a voice or sharing on social media, don't hesitate to reach out. So I appreciate you, Tim. I appreciate you, Dennis. Good luck on your fundraiser. Let us know how it goes, and hopefully we will continue this conversation soon.
All right. Appreciate you guys. Y'all take care. Have a great weekend.
Guys, thank you.
Thank you so much. Yeah, Hope. I don't know, Hope. I feel like locally, do you know your mobile response team over there in DeSoto?
No, and that is one of the issues that I think that what we've talked about so far has really brought to light is, even working throughout Central and South Florida, I've never come across anything about the mobile response units. And if I had, it wasn't really evident. So that's something I think that if you are out there and you are a part of those mobile units, please let us know, especially Central South Florida. That's where we operate a lot. Let us know. Let us know in the comments. Let us know in the chat. Shoot us an email, because other people need to know about you. The work you do is important, and we want to be able to share that.
Yeah, well said. And that's not to say that they're not doing incredible work. I'm sure that they are. I just want to hear about it. So if you're involved in the mobile response side, helping address crisis in Florida or outside of Florida, I'd also be interested, Hope, to hear from some organizations outside of our state to see how they do it, because maybe there's some best practices there that we can bring here.
Well, and also as they were talking, Curtis, it came to my mind, I think of all the adults that are Baker Acted, especially involving law enforcement, where law enforcement, in more recent years, law enforcement is more aware and more trained in the mental health field. However, prior to these, probably last 5 years, maybe 6 or 7, I think a lot of mental health issues were maybe confused as, a type of criminal activity. And I would like to know about if there's mobile response units like this for the adult system. That's something I'm interested in. So if anybody knows of anything like that, that would also be something I'd like to hear about.
Yeah, in the comments, tell me if you know who your overseeing agency is for your mobile response team. Like who what is the number? Who do you call if there is a crisis? Because I'm interested to hear the how St. Augustine Youth Services is doing it. Sounds very impressive, especially since you're talking about the 365, 24/7, the peer support element, which again, bringing somebody there who's been through it, you know, you cannot have a logical conversation with an emotional response. So when someone is heightened emotionally in these situations, the first thing you need to do is connect emotionally. And what better way to do that is to have someone who can immediately feel what that person is going through because they've been through it themselves, you know? So I'm really interested to hear if that's a best practice that's across the state and potentially across the country. So Hope, that was our first guest. We have another guest waiting for us in the lobby here because we are pivoting to workforce and development. As you know, C.A.P.E Conversations and the Aware News Network is all about child welfare, juvenile justice, and workforce development. And I have heard that there is actually something very big happening in workforce development right now that we need to talk about. So I want to welcome Malyn Smith. How are you doing, Malyn?
I am great. Thank you for having me.
Hi, nice to meet you.
We got the audio working, Malyn.
Yeah.
Yes.
So Malyn, obviously with everything with workforce happening right now, and specifically Job Corps, there are a lot of conversations going on social media, on LinkedIn. I feel like every day there is a new update. So I'm interested in talking through some of those with you from your perspective. But I think the most important thing right now is to start with the why, the what and the why of Job Corps. So tell us a little bit about your experience with Job Corps, how long you've been doing it, what is it, and then why does it exist? Let's start there, Malyn.
So, okay, thank you. The program has been in existence for 61 years. 61 years. I've been in the program 20 plus years. So this program is about, this is the biggest, I would say the largest residential technical training program funded by the federal government. And, you know, for 61, because last year we celebrated 60th, so 61 years of existence. And this program is for disadvantaged youth 16 to 24 years old. So we provide training in academic, certification, vocational, and we place them into the workforce. But I think the value, to me, the biggest value of the program is beyond that, because what's integrated in the program is the development of life skills for students. And also these students, they are disadvantaged youth. You know, they came from marginalized segment of our society. They're traumatized. When they come to the program, we provide a wraparound services, you know, from all spectrum of mental health and that issues. And you know, the program was intended for training. However, we recognize that we cannot impact training without addressing these issues in mental health and some other things. That's just the reality of, you know, human existence. So that's in a nutshell, that's the program. And that is the purpose, you know, placement into the workforce. But of course, you know, in order for us to be effective in getting into the purpose of the program, we recognize those issues that our students, you know, experience before coming to the program.
So the overall, and what people might think that aren't familiar with Job Corps is, okay, good, you get them a job. Okay, good, they get some schooling. But on the campus itself, it feels like it's a lot more than that. You talked about the mental health side. So I'm imagining they're having some sort of access to a clinician or a psychologist on site. What are some other services that are on campus that address some of the needs that might not immediately come to mind when people think workforce?
So on center, yes, we provide mental health services, medical, and we are limited with resources like that, So what we are doing is we leverage community resources. We partner with public health and nonprofit organization to augment the resources that we have in order to meet these needs of the students. But yes, we have mental health clinician on center. We have career counselors. But if our students' need is beyond that, we leverage community resources to meet the needs of the student, because we recognize that those are the issues that our workforce are grappling, members of the workforce are grappling in their journey into the workforce ecosystem. So in fact, actually, when I was as a center director, I worked with our local community, organizing what are the resources, mapping the resources that we have in the community, and work with other workforce provider, so we can, as a community, as a team of community, not only Job Corps, we can identify these resources and help our young adults, Job Corps and other young adults in the community, navigate this one-stop shop where resources can be found. From shelter, what are the resources of shelters that we have, housing, childcare, drug abuse counseling, because, we recognize that's a social issues that we have to recognize. Transportation, it's a big thing because, we have a single parents also. So childcare, transportation, mental health, those are really the issues that we as workforce providers, we have to recognize if we would like that, the youth that we're training will become successful into the workforce ecosystem.
Absolutely. So can we, Malyn, Hope and I dove into this topic last week on the first episode because we were trying to process the numbers. There's a lot of numbers that came out with, I believe it was called the Transparency Report. And then there was a follow-up to those numbers. I believe they were on the Hill speaking about, there's some other factors that contributed to this. So the reasons that were cited for the potential closure of Job Corps were graduation rates, were lower than expected. There were violent incidents, security issues. I'm sure all of these you heard. Can you take a couple minutes here to speak to some of these and perhaps provide the other perspective on some of these reasons for the potential suspension of the Job Corps contract?
Absolutely. So as what I mentioned to you in our previous conversation, this information, it's inaccurate. So I will start with graduation rate. In that report, it says it's just 38.6%. Well, the data that they based on that report, that's during COVID, okay? And, you cannot discount the years before that, the performance of the program. So,
and can I just, on that for 1 second, Malyn, if I remember correctly, because I remember during COVID, I did a little bit of virtual training for those campuses, and they were having to, this is a program where traditionally the students are on site receiving services one-on-one, and then all of a sudden they were asked to provide those virtually, which I imagine is a whole nother, it's just not what how the program is packaged or what the expectations were of the student. And there were tons of programs that had to navigate that during COVID. When you say the numbers during COVID could be impacted, would that be part of the reason, because how the model was set up, it was now asked to deliver a lot of these things virtually?
Yeah, during COVID, as what you said, the program was not set up like that. And then when COVID hit, like I would say here in Alaska, the connectivity is a big problem. And if we deliver training virtually, majority of the students here in Alaska Job Corps Center, they live outside of the road system, so there's no internet, or if there is, it's very minimal. So how would you deliver that, right? So it would impact the outcome of the training. But historically, graduation rates of Job Corps have been above 60%. But they only focused on that period of time during COVID, which, there's a lot of things that could impact that. And that is beyond our control. So that's one. Now, the cost, they claim that Job Corps cost as much as $155,000 per student. So the Job Corps cost is less than $50,000 per student, according to DOL's report. So this is an increase from report during the first Trump administration, which indicated that the cost per student was $34,301. So the increase is due almost entirely to COVID. Why is that? We lost a lot of students during COVID. And of course, because of COVID restriction, the number of Job Corps students is allowed to serve. So some of which are still in place. So if you are going to spread the cost to that, small group of number of students that we serve, of course, the cost per student will go up. And also another point is the cost per graduate is higher than the 4-year college. So
can I ask, just for the viewer, so that the viewer understands and that I understand, because this is definitely not my area of expertise. There's a cost associated with running the campus. And if we're running that campus with a limited amount of students, then obviously the cost versus the students being served is going to be so much more expensive. Whereas if we're running at capacity or close to capacity, then the cost will drop dramatically, which would then reflect, hey, this is actually more cost effective to the economy than it hurts. Am I interpreting this correctly?
Correct, because the cost will be spread out to the actual number of students that we serve. That is correct.
Gotcha. Does Malyn, the numbers that how are these numbers somewhere where we could pull live data, or at least data that's reflective of a time period that's more reflective of where we are post COVID now?
Absolutely. We, Job Corps program, I would just say this. We are on top. There's a lot of documentation record-wise, especially performance. This program is heavily, when it comes to report card, heavily measured, both quantitatively and qualitatively. There's multiple reports for graduation rate, for placement of students, to enrollment of students, you name it. We are dealing with probably 5 report cards every month to measure the performance of its center. So yeah, to answer your question, yes, there's information, there's record to show.
Gotcha. And is that public? Is where like Hope or myself could access that? How would our viewers look for that if they wanted it?
We can navigate that. That should not be a secret. But yeah, we have to go through the proper channel to access that report.
Understood. So then it would be fair to say that the powers that be who are making some of these decisions have the most up-to-date data that's reflective of how Job Corps is performing pre and post-COVID.
Absolutely. But, it depends on the purpose of what you are doing.
Sure.
You can use this or you can use that. It depends. But yes, you are correct.
Good.
They have that data, but selected.
Yeah, I'm sure. Hey, as Hope and I both worked for various programs, how we view a success, you tend to that perception of the data does sometimes lead to the outcome we want to have happen, right? And I think you can say that in any business, which is why we're talking about, okay, what are the numbers now and where can we access those so people can see both sides of it. Let me ask you this, Malyn, before we go, and I truly appreciate you, by the way, joining us and talking about something that I know has to be emotionally jarring and quite frankly, really upsetting, considering, you know, a lot of our students might potentially be back into the communities without completing education or having housing or worse. So if we can, talk to me a little bit about the perspective or the pitch for people who say, look, there's a better way to do this. I don't know if my tax-paying dollars just go into allowing students to just live on site and maybe graduate. Like, I don't know. What would you say to those people who are kind of on the fence of the impact or importance of Job Corps in their communities?
Well, I would say that the program could use some reform, you know, and it's 60 plus years. And of course, you know, that we recognize that we could use some revisions of the models of the programs, training programs that we offer. That, yeah, I agree with that. But I think the program has impacted a lot of, and I think the taxpayers' dollars are being used really productively in this program. Like, so for example, you know, the funding of this program is level funded. So, you know, level funded for since 2018 up to through June 30, 2026. So that's level funded. It's the inflation rate is not factored into that. You know, that's really one point to consider. So that's the funding right now. We are funded through June 30, 2026. And I don't know, there is no the oversight of the program when we say making sure that you know, the taxpayers' dollars are being used productively. The oversight of the program by DOL is just, I would say, a top notch. You know, there is a constant oversight we have. There is a corporate review. There is, you know, a DOL review that is happening regularly. They look at through centers, looking at the report, visiting centers to make sure that everything is happening according to the contract that they laid out for the operators. So, you know, for the, I do not know what else to say for those who don't believe in the program, because the proof is in the pudding. And what's that? The graduates, the graduates that we produce, the students, the success of the students out there who went through the program is a living proof of that.
And I just want to piggyback on just one thing you said, Malyn, so I understand too, and the viewers do as well. Some of the response I've seen on social media from the other perspective is people are acting emotional. They're responding too emotional to what's happening. People just need to look at the data logically, all this stuff. But you said something that I think was interesting, which might be contributing to some of the emotional response. One, obviously, anyone who works in this field that helps young people, if those young people that they believe need help are now placed in a situation where they're not getting that help, anybody's going to initially respond like, wait a minute, what are you doing, right? Because we're in this field to help young people. So if you do something that is not perceived to help them, there's going to be an emotional reaction. But after that, did you say that the funding for Job Corps it's already in place or should be for 2026?
Correct. So yeah, we have the funding until through June 30, 2026. But after that, Job Corps program, Job Corps was not included in what we call the skinny budget or the discretionary appropriation. Okay, so that's another thing that we have to work on with our lawmakers. So as you are aware, on Wednesday we received a TRO. You know, we have to touch on that a little bit. So last week, May 29, we received the notice of closure. Okay, and then Wednesday, we received the TRO stopping the center closure, stopping that notice, and all the activities required in the notice, which was issued last May. Now, there's a hearing in 2 weeks, and so this is really good because this gives us a temporary relief to allow our students to return to their normal training activities, program and housing. Okay, so it will give student and staff a sense of security. But even with this TRO, we cannot. There are still a feeling of uncertainty with some of our students and of our staff. For staff, their employment, and for the students, especially those that don't have places to go back to, the question they ask is, okay, so will be, displaced again, because is this going to be permanent, or is this, there's a lot of questions into that. But although it is short, it gives us a time or a relief to help these students. So right now we are bringing them back to the center and continue to do training and kind of like repair because if Cortez, the students with this action, it re-traumatized the students. It re-traumatized the students. So that's one thing. And then we are going to work on the budget so the program could continue. And again, that's another battle that we are going to do on the Hill.
So right now, that temporary restraining order essentially says students don't have to go home while they continue to litigate to find out when the actual closure will be.
Yes, that is true. But there were already students who went out, last week. But, we have a big chunk of students still who are on center. And these are really the students who kind of like, they don't have a place to go. Remember that on average, about 20% of our students, across Job Corps centers, they are homeless, and they are minors, or, they age out of the foster systems. So it's difficult where we are going to put them. Are we going to put them back on the street?
Wow.
That's right there. That is, this is the life of these young adults who look at Job Corps as their last chance in life, the last stop. And with all this happening, where else they gonna turn to? So it is very it's so draining for all of us right now, but we have to continue for the sake of these young adults in our hands. So right now, we are working with our centers to bring the students who were out and to normalize their life right there while we are doing this legal battle.
And speaking of that, let's end with your call to action of, if people want to get involved, if people want to support Job Corps, what can they do? Where should they go?
So we are actually we are calling for everybody in the community, friends, employers, graduates, and especially our lawmakers. So if you can help us advocate to your congressional delegation, lawmakers right there, to advocate for the funding of the program after June 30, 2026. That's really the big thing right now, the big thing that could help save the program.
So call their elected officials, talk about their support for Job Corps, let them know why it's important to their community, essentially make your voices be heard.
Be heard, yes.
Awesome. Well, I appreciate you, Malyn. Again, this is not an easy conversation to be had. I remember in my juvenile justice days, if all of a sudden they said, hey, this way that you're serving and you're helping others, now you can't, that would evoke a lot of action for me too, to want to get involved. So, but it would be a tough conversation. That's why I thank you for coming in here, getting involved, letting your voice be heard, and giving people the other side and a perspective on how to get involved if they decide that is what they want to do. And any final thoughts, Malyn, before we end with this part of the show?
Well, I would say first, thank you, Cortez and Hope, for I was so surprised when you invited me here in this forum, because we need everybody, we need the support that we need. So first of all, thank you so much for allowing me to share this information to our viewers and our friends. And I think I would just say for the viewers to please continue to support Job Corps.
Well said. Well said. Well, thank you, Malyn. Keep me in the loop if there's anything we can do to continue to raise awareness and have that conversation, and keep sharing those success stories of our students, because I think that's one of the most impactful things you can do. And we appreciate all the way out in Alaska, you're helping, despite the cold, you're helping others. So thank you so much, Malyn. We will talk soon.
Thank you. Bye.
Bye. Thank you.
Yeah, Hope, this is another one where I think the part that stands out to me the most is the abruptness of it. Diving into the data, I think that's going to be something really important too, to look at some of those active numbers. But I can tell you, from someone who was involved with Job Corps during the COVID part, I mean, quite frankly, we ran community-based programs during COVID, and to try to pretend like that didn't impact service delivery or engagement or outcomes, I mean, I think that would just be a little silly,
Yeah, and I think this speaks to one of our big questions last week was, where did the data come from? Was it correct? And just since last week, we found the first data that went out was not correct. This second group of data that's come out is a little closer to home, but we're still hearing it's not quite as accurate as it should be. So I am interested a little bit more to see how the data plays out, because it just sounds like that initial article, the initial reports that went out, really made it look like the success rate was half what it actually is. It didn't portray the success stories that have been promoted. And one of the things that she said was the proof is in the pudding, right? The proof is in the graduates. So one thing I'm interested to hear, and if you're listening, whether you're listening live or you catch this live later, and you are a success story, or you know of a really good success story, these are, I think it's 99 sites that have been affected. So that's a lot of students. So if you know of those success stories, I personally would like to hear them. I'd like to know more, because there are data people and there are heart people, right? We need to present both stories, the data and the heart. And together, that's where we get a clear picture of what's happening. So if you're out there, you're listening, and you're either a graduate a successful story or staff who have some successful stories, please go ahead, put that in the chat, share links with us, give us some emails, let us be able to, one, hear that side so that we could also share some of that.
Absolutely. And the thing I appreciated that Malyn said too, and we didn't get a chance to really unpack it because time is flying, and I got Jimmy waiting for me. Jimmy, if you can hear me, it's 7 minutes past, sir. Don't worry. I'm going to give you your 7 minutes back. But the thing Malyn said is that she acknowledges that there's opportunity for reform and improving Job Corps, which is which I was glad to hear, because the premise that, hey, just keep everything the same, just keep everything the status quo, I just don't think that resonates with people these days, right? No. They understand that we want to grow and change. So based on the conversations we just had with Malyn, and I've talked to with other Job Corps people, this isn't a just keep everything as is. There's okay, we see opportunities to improve, so let's improve it, but let's do it without the abrupt nature of saying, hey, we clean our hands of helping these students. And just one clarification, Hope, on the fiscal side. I just want to provide this for the listener too. It says the administration's move to eliminate the program entirely from the 2026 budget proposal without prior consultation of Congress was deemed as overstepping executive authority. So that's the argument from the other side, and that's why it's led to this temporary restraining order. So in essence, the funding was set to end in 2025, but with the expectation that it would be continued. And then it was the sudden, no, it's not. And we're not even going to discuss continuing this project of Job Corps that's created these reactions you're seeing. And now the sudden, hey, fight, this isn't what we've been expecting. So I just wanted to provide that additional context for the listener. So Hope, let's go ahead and jump to our final guest, who I have just been making wait in the studio here. That's just unacceptable to me, Hope. Let's get him in here. There he is. How you doing, Jimmy? How are you, sir?
How are you? Good to see y'all today. Thanks for having me on. And listen, you guys were having very important conversations. So we wait for the truth and we wait for objective reality. We're good for that.
I like it. Yeah, we've been having some good discussion here, Jimmy, and some very serious discussion. But I just get the vibe that with you, we're gonna add some lighthearted discussion too, and some positive energy. You take me as a positive guy, Jimmy. Is that something that I'm making an assumption of, or?
No, well, I've been through a lot actually. And first, Hope, it's really nice to meet you.
Nice to meet you.
So I don't know how real, I don't know how true we want to be here, but I was an addict, and I actually was homeless for 6 months, and so I have a very strong faith relationship with God because I believe He brought me out of that. And I mean, the story is incredible. It really is. It's wild, and He's changed my life. And so all these 10 years after that, 11 years, 12 years after that now, I'm married. I have a beautiful wife. I have 2 children that we've adopted out of foster care. We've stepped away from foster care now at this point, and we're focusing on them. Just trying to build our family, and we'll probably enter foster care again down the road. But we have a 15-year-old and 8-year-old. I've been ordained for about 8 years. I'm a worship pastor. As you can see, actually, I'm in my office. I've got a piano behind me and a guitar over there. So we come in here and I work at a large Christian agency called One More Child, where I'm the director of maintenance facilities, and we're the headquarters for OMC, but we do a lot of child welfare stuff, helping single mothers and foster parents and victims of sex trafficking and human trafficking. And so, yeah, it's a whole lot, but I'm also a huge angler. I am a fisherman through and through, and I actually went today. I had a really cool opportunity where somebody was donating to our ministry, and he brought a bunch of fishing poles, and we went at lunchtime, and I went with one of the guys on my team, and we caught a bunch of fish. It was great. And so that and my faith walk led me to create it's pretty new right now, but it's been burgeoning, bustling, a ministry that we call Kingdom Catch. And so, yeah, that's what I'm here for today, to tell you about it.
So,
Yeah. Oh, I'm sorry, Hope.
no, I was just going to say fishers of fish and fishers of men.
You know it. That's right, sister. That's it, 100%.
Yep.
I knew you and Hope were going to get along, Jimmy. I'm telling you.
That's it. Cut from the same cloth. Spirit, that same spiritual robe.
So I definitely want to talk about Kingdom Catch.
Sure,
because,
yeah, ask me anything.
I originally reached out to you because of the work you do at OMC, and I've trained OMC in motivational interviewing a handful of times. And one of the areas that stood out to me the most, which the incredible work you do for human trafficking victims, is just there's a lot of fields that I've worked in, but one of the most challenging ones emotionally is when you talk about children who have been abused or trafficked. It's just it's hard to. It's really emotionally draining and tough. So the work that OMC does in that area, I just want to give a shout out to them. If anyone has any additional interest on the great work they're doing in that field, please visit OMC, I believe, .org for that.
Yep. One more, all spelled out, onemorechild.org, no numbers.
Onemorechild.org. So what I want to touch base on you before we go to Kingdom Catch, though, because OMC, really big organization in Florida, Kingdom Catch, small, just a startup, you're heading in that direction. And I think when you're talking about influencing change, it really does start with the boots on the ground, the people on the ground who are saying, I'm going to do more than what I'm currently doing, which in this day and age is such a, what? How are you going to add more to my plate? But when it's connected to your why and a belief of the impact you can have, we figure it out, right? But before I go to that, I want to talk a little bit about your experience in foster care, because you said you adopted 2 children. Obviously, my story and why the Aware News Network was even created, it's all rooted in our experience with adoption. So tell me, one, what made you decide to want to foster? And then if you can a little bit share with our audience maybe some misconceptions about what it means to foster and being a foster parent and then adopting through the system.
Absolutely. So, and I'll try to be as succinct as possible. One problem I never have is a lack of words. So, okay, Curtis knows that. I met him through motivational interviewing, and I'm the way, like, hey, let me tell you something.
Yes, you were like a co-trainer in there, Jimmy. I remember.
I get excited. So first, I want to touch on that human trafficking thing. It's awful, and it is ubiquitous. It's everywhere, guys. Do not be deceived. There is human trafficking going on in your county, in your town. It's everywhere, and it's terrible. It is heartbreaking how much is actually happening. Actually, in foster care, we had 3 young girls, who were HT victims who came through our house. Some longer than others. One was just a weekend. Another one was just 2 months or something like that. And that's a really tough story. And another one, she was with us for nearly a year. And the pain and the trauma that is caused by that is so much more than you could imagine. And so we need advocates just in every way, even if you support other agencies who are doing that work financially, or just prayerfully, or however you can get involved with that effort. It's huge. Now, I'm blessed to be able to mentor a young man in town who is an HT victim. And so we have a running relationship now, and he's a friend of mine. And, I just get to sow into him, and it's such a blessing. So, if you have those kind of life experiences, and I wasn't, HT, but I had a lot of trauma, and when God led me through that. And so now I can help out in that way. So now when it comes to foster parenting, my wife and I both knew it was a calling for us. That's important. We play in our music. We actually have a band name, me and a couple guys, and it's called Sacred Echo. that actually means something. So we don't have a Facebook page or anything. You can't find us there. Though we go out and we do some things at some of the, Christian festivals in town and whatnot. And that sacred echo is what I call that the quiet, still, unrelenting voice of God in your life. It's peaceful. It's not like, you better do that. It's that voice that pierces through the fabric of your being over and over again. It's the thing that you should be doing. It's the thing that sometimes we don't listen to for a while. We take our brain and we're like, I don't think I could do that. How could I add any more to my plate? Right, Curtis? And for us, we both knew that it was a call to be foster parent. We knew it and we couldn't deny it. And so we stepped into that arena, and for say a little over 4 years, my wife is better with dates and time. And so I'm going to say around 4 years. And so misconceptions in that is that you're going to come in, you're going to be a savior. You're going to come in and you have got things figured out. That's an entirely different arena. It requires humility. It's going to be, I don't say this because I want people not to be foster parents. We need foster parents. We have such a horrible lack of foster parents, and there's kids that are sleeping in the offices. We'll get calls and there's 10 kids set up on a cot in the office because there's no place for them to go. That breaks my heart. That is so difficult. It will be one of the hardest, most purifying things that you'll ever go through, but it's also going to be the most rewarding thing that you'll probably ever do. And if you can learn to be patient, kind, humble, loving, it's the way that Christ is, with us as a Christian, as a pastor. To me, I came to Jesus because he never stopped loving me, even whenever I was at my worst and when I hated him or didn't believe in him. He was always there, and I knew that. And so we learned that that's how we have to be. But when you see lives change, when you see a kid who is so traumatized come into life and calls you mom and dad, and you get to teach into them important, it's amazing. It's truly amazing. It's a blessing. So I think there are a bunch of misconceptions, but let me stop yapping and you go ahead.
No, so essentially, to be a foster parent means to provide stability in a crisis, in a situation where the child just needs essentially love, and then those basic needs. So in your situation, it was a calling to help these kids, not necessarily hey, I want to adopt. It just naturally led there.
We had no idea. That's a big one too, is the misconception that you might go into foster care to adopt, like that's your plan. Well, when I tell you that is, like, you go into foster care, you might adopt it, but it is a natural progression. But for instance, our first kiddos who were in our house, we thought that we were going to adopt them. We didn't plan on that. They came in, and it looked like that was what was going to happen. The young boy who was with us, we had become like their mom, dad, and so right close to the last minute, a family member out of nowhere came from Pennsylvania, came and swooped in and said, "No, I want to take them in." We didn't think there was any other family left, and they were gone with like that, and it was so hard, so heartbreaking. But I have to tell you this, just weeping as they go. Okay, let me tell you this. We were nervous for their future. We were praying for them. We just didn't know. We didn't hear anything back from them. Like 2 years later, we get a phone call that their mom, they were all in Pennsylvania. They were all together. They were living at a beautiful home. Mom had gotten clean and is still clean today All of the kids are doing amazing, and they are not just living, they are thriving. And we get to FaceTime with them. We didn't know what was going to happen, but it was good for them to go back because they're family again. And so you don't know, but you have to pray, and you just, you really hope deep down and have faith that the best thing's going to happen.
That's incredible. And what I love about that story is it's just 100% putting child above all else. And then you could have easily said, wow, why is this happening? We thought that we could have adopted, but instead you were hopeful, you prayed, and then you got to see, hey, this was the situation that, look how happy this kid is. And that's a beautiful moment, because that's such a kid focused perspective to have during the foster process. I appreciate you sharing that story and being vulnerable with it, Jimmy. We'll
have to talk another time about just the whole foster experience too. I would love to, because there's so much I want to tell you, so much that could be so enriching in that realm. Things that we've gone through and that we've learned that are indispensable and have changed us. As my heart is so much bigger, I'm so much different because of what I've gone through. It's been the most, and it's not for me, it's for them, but that's why you get to grow, because you're giving of yourself and you're not thinking of yourself. And that's why you are blessed with the ability to grow in those circumstances.
Absolutely. And we actually have, I'm going to connect with you separately, Jimmy, but I scheduled for July a fireside chat / town hall that focuses primarily on foster care in Florida, from the perspective of foster parents, adoptive parents, relatives, biological relatives. And it's more of an education session to squash some of these myths, these misconceptions about the process, so we can get all that nonsense out the way and really identify people who can get involved and help. So I would love to have you on a guest with that. I'll send you the information for that. Well, what's really important to me as we near the end, I want to talk about Kingdom Catch, because this is something that you decided to do, not because, as I believe, and correct me if I'm wrong, but not because there was some funding stream that paid you to do this, or not because OMC said, I need you to do this. But this was something you did because you felt it could help and make a difference with foster children. So talk to us about that.
Okay. All right. So Kingdom Catch is one of those things that God put on my heart. And so I have known that I've wanted to do ministry and fishing for years. It's another Sacred Echo kind of moment. I had no idea that this was going to happen. And about a year and 4 months ago or something, I was overwhelmed with this feeling that I needed to do it now. It was a conviction, or else it was going to pass me. And I could still help out in that arena, but I knew that it was time. And it's a very, very strong feel, it's an emotion. It's a conviction in my eyes from God. And it was so clear. And he gave me a vision that day of where we're going. And so we're marching towards that. But so we went all in. My wife woke out. She was already asleep. We woke up the next day and I was like, babe, I made the page. It's happening. So she's been my number one supporter, and she's just blessed me so much. So there was it's totally detached from One More Child. Although I do have opportunities to help children within One More Child and our partners. And our next outreach is coming up July 19th. And what we do in an outreach is we actually go out for the day, we go fishing. I usually have children who have experienced trauma who come. So because my heart, has been for foster and adoptive care, but I always say that we're ready to bless anybody who needs a touch of light. And so for an outreach, that's our kind of big thing, but we have a bunch of different little tendrils, and we'll take them out. We have a day of fishing. We set up the tents and everything, and we get a bunch of food that doesn't cost families anything. Get a bunch of food, bunch of pizza. We set up extra games in case the kids kind of get bored for fishing, cornhole and stuff. And then say we have 15 kids. I set up a rod holder for each one of them, separated apart. I rig the fishing pole exactly the same way for everybody, at least while they're there. And God has just blessed us so much. We've caught so many fish. We have some really cool stories. And so while we're there, we pray, we talk, we share our heart, and we make these connections too that go out after that. When they're done, they get to keep their fishing pole and they get to keep a tackle box so that they can go out and continue the joy. And so, yeah, it wasn't funded by anybody. Started off really just out of our pocket and just a love thing, but quickly people jumped on board and they were like, we want to be a part of this. So we're getting these donations of fishing gear, and so it's been really cool. And also we have a sponsor from Handing Fishing, who is this company out of China, and they send this Christian ministry. They send us fishing gear, which is so cool. And so we are overtly Christian, so that's pretty neat. And so our website there, www.kingdomcatch.org. You can type .com, .net, all that. We were blessed to have the domain. Our website it needs a lot of work. It's outdated, but thank God for my wife who set that up. So yeah, I mean,
is this happy guy right here, Jimmy?
I don't think so. He looks different. Don't message that telephone number. That's one that my wife set up. There's like I don't know if it works. So just hit me up. Hit me up on. We have a big collection of people on Facebook, Kingdom Catch. So we've got Facebook, TikTok, YouTube. Those are the three that I stay with. But also we do random blessings of gear. So if I meet you out, and yeah, that's it. And we're actually about to do a giveaway right now for followers. The details are on the page. As soon as we hit 4,000, and whenever you get a chance, you got to watch that little girl up at the top because it is hilarious. That clip is the best. I don't know. Does that play through the sound, Curtis?
Let's see here.
Yes, there's no sound, but you can see. So right here, she catches a giant tilapia. She goes, "Mom!" and she runs off. And so we pull it up. Everybody's happy. Those are my friends, Austin and Victoria, who are volunteers. Big old tilapia. Watch this. Watch this. She was so excited. And we just have this awesome excitement. The kids have such a good time. And I always say that we exist to share the love of Christ through the joy of fishing. And so in our community online, it's constant positivity. I have 4 major tenets that I pass everything through. And I also own a 36,000+ member fishing page called Ultralight Fishing Enthusiasts. And so I started that. I have a bunch of great guys who are helping me to watch that because I'm busy with Kingdom Catch and stuff. And so we have 4 major tenets: kindness, encouragement, respect, and light. Everything that we do, it gets capital L light for me, but we're trying to shine that light into a dark world. However we can do it, through donations, through outreaches, through circumstances that haven't even materialized yet. That's where we're going. I can't wait till we can get a boat. But my eventual goal is I also make that content online. And so we received our first paycheck from Facebook for just over $100, which is meager right now. Thank you, sir. Thank you. And but the eventual goal is to prayerfully make enough through content creation, which is actually a feasible goal these days. I know some really cool statistics on that, for the sake of time. So it's a true goal now. And then I want just enough to make sure that my family's needs are taken care of. I could not care less about being rich or anything like that. I just want to take care of my family. And then my goal, I want to be free and volunteer my time unpaid for ministry. So either through, Kingdom Catch, we'll do tons of different little outreaches and stuff, but I want to be available on a Tuesday afternoon to go fix someone's sink at church if it's broken, something like that. That's my goal. And so we're working towards it. And we keep seeing things like coalesce, which is really cool. We just got a sponsor, a fishing lure maker in town, who's a friend of mine now. He is donating 10% of what their company makes to support Kingdom Catch. So it's wild.
Let's shout them out again. Who made
Yes, that's Granger Hieronymus, and his website is Hieronymus Outdoors. Now that's a tricky one. I'm going to say it's Hieronymus. And I may have messed it up. It may be MUS, but Hieronymus Outdoors. If you
Google will figure it out if they type that in close enough.
Yeah. So thank you again to Granger, and thank you to Andrew who came today and donated some rods. And it's just, we're trying to give with open hands. And so I'm a firm believer of what you sow is what you will reap. And so as long as it keeps coming and funneling, the second I do that, that's when everything falls apart. And then the one big scripture that's been on my mind as a Christian, we have everybody in our group. I have a lot of people who are not Christians. They just love positivity, and we love life, and we want to shine light into dark places, like whatever that means for you. But I'm remembering, seek first the kingdom of God and his righteousness, and all else will be added unto you. So basically, put Jesus first and everything else falls into place. And so far, the more I do that, the more I see it's true. So that's us in a nutshell.
That's awesome, Jimmy. I just admire, again, that I know how much you have on your plate at OMC, and then how much you do for the community. And then to add this other level, especially for foster kids who, I'll say it and I keep saying it, this is a population that at no fault of their own are placed in some of the most vulnerable situations where trauma can occur, and they have these needs. And caring for our kids in the foster care system is a bipartisan issue. It's an issue that everyone should get around, and it's an issue that everyone can help in some way. They don't have to create a fishing program like you, Jimmy, but there's a lot of other ways they can get involved. So I appreciate you joining us on this live stream. Can you repeat for me again, if someone wants to get involved and help with Kingdom Catch, what do they do?
Yeah. So one thing, if I can, Curtis, you and I were talking before this yesterday, and I think it was such a salient, important point that you don't have to do what I'm doing. You don't have to do what Curtis or Hope is doing. You don't have to do what anybody else is doing. But if you can find, we are so much consumer based in this world. If you can find a way to be a producer, because if you consume it all up. There has to be producers. Are you a producer? And what are you called to? What is your joy, your deepest joy? You can go and make that happen. You can go and bring light. You can bring production into this world because of something you truly love and something you are truly called to. Ask yourself that. You don't have to have the parameters that other people have had, or even that your family's had, or those expectations. There's something that you can do that only you can do. And you can do it. It's okay. You have permission.
Yep. And I just want to piggyback off that. So what Jimmy is saying, and Jimmy said it very well, and allow me just to elaborate a little more.
Please.
We always find time for the things that excite us and bring us joy. We find, no matter how busy we get, we end up finding time. And just think, we work with people and helping professions that one of the biggest things they say is, I don't have time. And there's so much truth to this because of the burdens that are placed on people who decide to prioritize others above themselves and be in helping professions. But even with those individuals, I guarantee you, even if it's a Netflix show or it's going on a walk to your favorite place, the point is you find time for the things that bring you joy and give you energy. So do that in your work as well. Find the parts of your job that get you most excited, that when you wake up and you think, I get to do this thing, you have a little more pep in your step going into your work. Go seek out more of that stuff. Find that thing. And it's amazing the impact you can have on others by channeling the things that also bring you joy. And I think that's what you did, Jimmy. And I appreciate that.
I didn't think it would work. And I actually had to fight against my inclinations that it was the wrong thing. And even still, some people don't understand my vision or my mission, but I think they're getting to the point where they can tell that it's true, that I mean it, that it's from a place of faith, and that this is what I'm called to do. This is my mission. And so we charge forth, right?
Absolutely. And I think too, Jimmy, the proof is in this live stream, right? Because we had the St. Augustine team on first, where they have a 365 days, 24/7 mobile response team. So there's never a dull hour for them, and they find time to make it happen, right? Because that's their why. We have our Job Corps team who some of them live on site on these campuses, and this is a 24-hour campus. And when the campus is potentially going to get shut down, they're doing all these other things to find time to advocate for the things that are most important to them. And it's just like you're finding time. We find time for those things that excite us, especially when that excitement can lead to having an impact on people. And I think that's a great message for anyone watching is be that person. And it looks different for all types of people, but it is there. So
well said, my friend. Well said. Well,
Jimmy,
if anybody wants to find us, we hope you do. We got a really cool community. The best place is honestly Facebook. And if you don't, it's Kingdom Catch. You see it on there. We've got about 4,000 followers right now. We're growing all the time, but just such a positive, loving community of people right there. But then also I'm on, like I said, TikTok and YouTube. And TikTok is probably the other best way to reach out. But you can send me an email. And that if you go to www.kingdomcatch.org, there should be an email address on there. And I'm going to start checking that one.
And we got to find out which of those numbers works for you. You got to get with the wife.
Yeah.
Hey, what's going on here?
I think the one that she put there forwards a message to me. So Curtis, if you want to give it a shot, and that'll tell me for sure.
I'm going to send you a text trying to extend your car warranty later.
I'll totally receive that and pay attention to it.
Yes, absolutely. All right, Jimmy, we appreciate you. I have no doubt that we're going to continue this conversation on another live stream and then also get you on a podcast. And like I said, I'll circle back with you on that fireside chat regarding foster care in July and let you add some additional value to that for us as well.
That's good. I sure appreciate you, Curtis. Hope it was a really nice opportunity to meet you. God bless you, my friend. And we'll talk again soon.
Yes.
Yeah, and I feel bad for Hope having to be on a live stream with two gentlemen that talk too much. So Hope.
Sorry, Hope.
Too much of a word in, Hope. I don't know if you have any final thoughts before we see Jimmy go.
I just want to say, keep doing what you're doing. I am adopted, and one of my first memories of my dad, when I was just a little girl, he made me a tackle box. He got me a little fishing pole, my size, and he took me fishing. And that is where I started to learn about patience, because he said, you just throw it in and you wait, you watch, you be patient. So I just want to say that the memories you are helping these kids and families make, they are going to last a lifetime. So keep at it.
Thank you. That means a lot. I really appreciate it.
Well,
sure will.
All right, Jimmy, we will talk soon. I appreciate you, sir.
My friends, God bless the both of you. Keep up your good work too. You guys are awesome.
Thank you. Thank you, Jimmy.
Thank you.
Yes.
All right, Miss Hope. We have neared the end. We are actually a little bit over time, and I should have. Well, actually, you should have learned your lesson last week when I told you that we would end on time, and now we have not again. So I don't know. Maybe you'll learn next week, Hope, that my end time is not my my actual end time. Thoughts on the episode today and some of the stuff we discussed?
Actually, I really enjoyed hearing from everyone. I think whoever has had the opportunity to tune in, whether live or catching it later, this was a lot of great information. 3 great entities with a lot of heart work. So if you've watched, go ahead and share some comments, share the live, just find a way to support these people. And I can't wait to hear what is next. And that's all I have for today.
Yeah. And on that note, if you are in a helping profession or you are in an agency that helps people, one of the main things you can do outside of the incredible work you're already doing is raise awareness, educate your community, and discuss the impact that you're having, because there might come a time where those proactive efforts will really come in handy when decisions are made. So And the other thing too, the main reason we're doing this too, Hope, is like we talked about last week. There's a lot of negativity in the world. There's a lot of nonsense on social media. We want to be that person or that stream that can kind of counterbalance some of that and remind you that there are a lot of people out there who just dedicate themselves to making a positive impact beyond just a social media post. So if you want to contribute to that conversation and be a part of that, I welcome you. Email me at curtis@speakformc.com so we can get you on the live stream. And then one just last thing I want to do for our C.A.P.E Hero Spotlight. I always like to highlight 2 organizations and Hope, I don't know while I'm doing this if one comes to mind for you. The one I want to highlight right now is, let me get it up here, Healthy Start, Florida Association of Families. I just did a motivational interviewing training for them. And the diverse set of people of helping professions on here is just incredible. They do education support for prenatal and single mothers. They do home visiting. They now have a program focused primarily for fathers for education and support. They just have such a wide array of services to help Florida families. And this is something that, unless you directly need it, you might not even know exists. But this is something where your tax dollars are going that is meaningful and helps your neighbors. It helps your community. It quite frankly helps everyone. And it all stems back to helping young people. And who doesn't want to do that? So shout out to the Healthy Start Florida Association, Healthy Start Coalition. And then my second C.A.P.E shout out, I think I'm just going to shout them out every single week until I no longer have an internet connection, Hope. And that is the Guardian Ad Litem office in Florida. Everything they do is they represent Florida's most vulnerable population, the abandoned, the abused, neglected children. They are the voice for them. And the reason I keep bringing them up, Hope, is because obviously this channel is all about raising awareness and asking questions and being vocal about the solutions and how we can get there. And Guardian Ad Litem does that for children every single day. So reach out to Guardian Ad Litem, support Guardian Ad Litem, get involved if you want to volunteer for them. They always need volunteers. And I actually have a special surprise in store for them as well, Hope, that I'm not going to share right now, but I have something secret happening. So yeah, those are my 2 hero spotlights, Healthy Start and Guardian Ad Litem. Hope, you have any shout outs for any programs out there?
Actually, I do. I'd like to shout out, if you guys know of this program, BAYS. So it is all throughout Florida, and they work with youth and families. I have the opportunity to go next week and work with their team during one of their annual meetings and train. And if you get a chance to look them up and just learn about what they do, go on their website, go on their Facebook page. They are making big strides with helping youth, with helping families. And I think, Curtis, are you trying to pull it up right now?
Yep, got it.
So empowering youth and families. And that's really what we're talking about a lot today, is empowering youth, empowering families, giving people the tools, the encouragement, the resiliency to make it through adversity, to overcome, and to really change the course of their life, right? So check out BAYS. They are a wonderful team to work with hearts of gold. And, you know, when they wake up in the morning until the time they go to bed at night, their mission is to serve families.
Absolutely. Yeah, and I co-sign everything you just said, Hope. I had a chance to work with BAYS a few times. When you're talking about juvenile justice, helping families transition, especially families that have been involved with DCF, getting that home stable again. BAYS just does incredible work across the communities and that we live in Florida. So we did it, Hope. Episode 2 of the Aware News Network. If you are watching right now, you weren't with us earlier, just a recap. At the beginning of our episode, we talked about the SAYS program over in St. Augustine and what they do for mobile crisis units. They work 24/7 and 365 days a year, and they respond to crises either in the home, in the schools, in our communities to try to reduce the number of Baker acts that happen and reduce the trauma with that experience. It's an incredible program, and the service is all across the state of Florida. So go to the beginning of the episode if you want to hear their CEO speak about that and the incredible work they do. Then we talked about Job Corps. Job Corps is going through a potential cease of their funding. They might lose their funding. And Job Corps is a campus that provides vocational training, workforce training, and then housing, mental health support, an array of services for students from underserved communities, potentially some at-risk students, so they can get their careers, get their education, go back to their communities and contribute to those areas that they live. We had a guest talk about the status of Job Corps, where it's going, their efforts to try to ensure that they remain after that June deadline. So you can go to the middle of the episode for that. And then we ended with Jimmy, who has a program he's starting called Kingdom Catch, where they take foster kids out fishing and just wrap them with love and support them. And it's amazing, Hope, especially when you're talking about kids, how something just as small as just taking them fishing, having a conversation with them, just having fun, the impact that can have on them. It can go such a long way. So that was our last guest. If you want to hear more about Jimmy, we definitely encourage you to watch that part of the episode.
Absolutely. And Curtis, I just want to piggyback a little bit off what you just said, is for any of these organizations we've talked about, it doesn't take a lot to give a little bit of support, and a little bit of support from a lot of people goes a long way. So, you know, just doing what you can do with what you have, what's in your hand. If you have social media, it might just be sharing information, sharing with your network about their events and their needs and what's going on. If you are financially able, it might be sending a donation their way. If you have connections in the right places to get them better connected, it might be making those connections. So we all have ways that we can be a bigger part of society, right? So just learning how to help in the ways we can with what we have. We don't have to do everything, but I do think we should all do something.
Absolutely. And that's what AWARE stands for, right, Hope? It's asking why and requiring everyone. And that's what I'm so proud of this conversation we had today, Hope, because we literally talked to mobile response team members in St. Augustine. We talked to Job Corps leaders in Alaska. And then we talked to Jimmy here, who's here local. And if you listen to each guest, they all have different perspectives. Their why is a little different. Some of the reasons they're approaching their job are different, and that's okay, because at its core is every single one of our guests wants to help people.
Right.
So that's a challenge for the individuals listening and watching. It's not, hey, listen to this guest and do what this guest is saying, or listen to this guest and believe what this guest is saying. We have no interest in having that debate. But what we do want you to listen to are their intentions and the drive to contribute to something bigger than themselves. So that's all we're asking. Just find the thing that excites you, find the thing that gives you energy, and then use that and leverage that to making a difference on the individuals in your community. And if that difference could positively impact children, even better, right? But whatever your pain point is or whatever your why is, go find that. It's not the same for everyone, but the basic foundation of doing things that are bigger than yourself, I think if we go that direction, things are going to be okay, Hope. I truly believe that.
Absolutely.
All right, people, I appreciate you. Stick around after I hit the end button, because I have a little sneak peek video for you. Ooh, breaking news, Hope. And then we will be back next Friday, back at our normally scheduled time at lunch, so you can eat food while listening to us. What is better in the world than doing that, Hope? So final thoughts before we sign off?
I'm good. I just hope everybody has a great weekend, and give us some feedback. Let us know what you liked, what you want to hear more of, and any comments about any of the questions we've asked. I'm interested in hearing from you.
Absolutely. All right, Hope. Thank you again.
Bye.
Narratives that need to be squashed in the foster care system. How could someone give up on that baby? Let's talk about Tez Johnson, wide receiver just drafted by the Buccaneers in the most recent NFL draft. His mom didn't give up on him when she said that he needed to go live with his high school coach's family.
Walked into the house and I was like, okay, I'm not leaving. They was eating at the dinner table. I was like, wow, they have something I'm missing right now.
His mom was setting him up for success because she believed her current situation was not the best for her child. That's not abandonment, that's sacrifice. That's prioritizing what a child needs over what you might want. Look, I am in no way trying to romanticize children being removed from their biological family. When it happens, it's sometimes occurring in the most dire circumstances, truly heartbreaking stories. All I'm asking you to do is maybe reframe your language. Instead of, how could she give up a baby? Maybe ask them, what made you step up for a child in need? And while we're on that note, adoption is not giving up. It's stepping up. So if you have an opinion that someone who settles for adoption is doing so because they can't have kids of their own,
you're wrong, you're wrong, you're wrong.
Wrong, wrong, wrong. Guess what? These are our kids. Period. So what's the solution? We need community-facing foster care town halls, not just recruitment sessions, but true fireside-style forums to raise awareness. Let's invite residents, churches, nonprofits, businesses, not just to become foster parents, but to understand the urgency, reduce the length of stay, and shift how our communities perceive foster care. When people are informed, they're activated. It takes all of us to change the narrative. Let's communicate in a way that makes it a helpful one. In short, let's have C.A.P.E conversations.